Bismillah ar-Rahman ar-Rahim. Good morning, everybody, from me and Gail Rosseau. So we are doing what we were ordered to do by the by you and also by Key Park uh, to do this launching of the new committee of World Federation of Neurosurgeons, which is the Global Neurosurgery Committee. Uh, So we're just going to tell you, there's been a lot going on about global neurosurgery right from 2016 when there was a Bogota Declaration in Colombia where we said that it is our duty as neurosurgeons to not only ensure patient safety but also to talk about and discuss with people and collaborate with people regarding how to move forward regarding global neurosurgery. And a number of conferences and things have been held since then. And the last, I think I remember, was in Weill Cornell in New York by Roger on global neurosurgery. And it was a great success. And finally, it was decided that we must have to do that. So why we need to organize global neurosurgery activities? This global neurosurgery is the practice of neurosurgery with the primary purpose of delivering timely, safe, and affordable neurosurgical care to all who need it, and also do the advocacy about it to everybody and to ensure that it is something which is required. So, a the Global Neurosurgery Committee was formed very recently. It was launched in Africa, I think, a few days back. And so the vision was universal access to life-saving or disability averting neurosurgical care. And the mission is to bring together neurosurgeons around the world to collectively address the unmet need for neurosurgical care. So there's been a lot of discussion about task sharing and task shifting and how we do it and how can we do it. And there are a lot of proposals and discussions. And to organize all global neurosurgical efforts should be coordinated to attain common goals and to avoid redundancy and promote collaboration and discourage work in silos. So we need to all be together and work together to work on this. And you may know that before this effort was started, there was very little search in the PubMed. And when you see that when global neurosurgery in the recent years was looked at, it became, the search went very high up because people started knowing the word global neurosurgery. Before, it was so many organizations, they were working on their own with different countries. Now, because of this global neurosurgery world, it has become very good. The Global Neurosurgery Committee and Action Plan. So the committee is chaired by Key Park and by Ohabi from Morocco, and these are the people who are on that committee. And myself and Gail Rosseau, we are very honored to be part of that committee. And the committee has been formed in such a way that as many countries as possible, and also that it is gender balanced as well. So it's going to be I think a very good committee. And so to achieve universal access to neurosurgical care, to align and coordinate all global neurosurgery activities within WFNS to reaching the goal. And Gail, maybe further
Okay, you
on.
want me to-
Yeah.
Okay, so just going over the objectives of this committee and what we're trying to accomplish with it, to stimulate and facilitate relevant research so that we can use this evidence base we've been talking about to inform policy with elected officials, to engage with other surgical stakeholders, the so-called SOTA specialists that we are talking about, and those who are involved in non-communicable diseases, and to co-advocate for investing in surgical care for everyone everywhere within this sustainable development goal of the UN of universal health care for all by 2030. So the framework will be to work on policy. So we've talked about some of the papers that have been done in task shifting and task sharing to bridge this gap in this neurosurgical manpower workforce that we have right now to look at optimal and efficient ways to expand our own workforce and to inform elected officials about how we think that should be done, and then to help with financing and infrastructure of surgical care and neurosurgical care in particular. We want to be sure that as this move toward access to global neurosurgery for all is it moves forward, that there's a focus on the ethics of dealing with local context and local training schema. And then in terms of institution, to have what should we do or what can we do with our neurosurgical institutions in order to move this agenda forward. So we're working toward having a dedicated section in each of our major journals that will be dedicated to global neurosurgery, as well as having global neurosurgery sessions, which you're already seeing at most international conferences. And the guiding principles will always be, as they always should be in public health, to strengthen the local capacity, not to come in and tell people what to do or do it for them, to promote financial risk protection, because we all know that right behind the tragedy of not having access to surgical care is the additional tragedy of so many individuals and families becoming medically bankrupt when they do have access to that care. And then we want to integrate what we're doing with the national surgical plans that are being developed by all the members of the UN.
So we are very lucky in Pakistan that outside Africa, we're the first country in this region in Asia that we launched the National Surgical Obstetric and Anesthesia Plan. And also, we are very honored in Peshawar that we were able to host the provincial surgical obstetric and anesthesia plans. And also, we were able to piggyback on that the recommendations, the policy recommendations for WFNS for us on comprehensive plans for the LMICs for prevention and up to rehabilitation, the holistic approach on neurotrauma in or neurosurgery in LMICs, which we are going to launch this afternoon. And this was a joint effort from WFNS, Harvard School of Medicine did all the work, and Northwest School of Medicine. So we are the first country in Asia to be able to launch the NSOAP, PSOAPs, and this comprehensive recommendations.
I'm so glad that you mentioned that. If you hadn't, I would have, because the leadership of Pakistan and of Tariq in particular is really important. And this is our goal, really, is to have neurosurgeons who are advising their individual national leaders in how to create the national surgical plans and to use what we know with the neurosurgical research that we're doing and talking about investing in order to have evidence-based neurosurgical input to national surgical plans. We also want to be sure that this is something that involves the whole world. So in those global neurosurgery sessions at international meetings, we want to be sure that we stay on target with this global neurosurgical action plan, and that at least 50% of speakers be from the countries that we're talking about, from low and middle income countries. And then in terms of research, if using data from LMIC, then the authorship should be from those regions so that we can start to get a better handle on what is happening with neurosurgical diseases that are for the most part happening in large percentages in the developing world. And then we want to assure access and dissemination of this information to the leadership in LMICs. And with this research that we're talking about, we've already mentioned that a disproportionate publication in neurosurgical disease to volume ratio that happens in LMICs, the need for evidence-based neurosurgical practice and resource stratified guidelines for how to best care for our neurosurgical patients worldwide, context-specific recommendations and quality research. And because these things are being done on a global basis, we need to have global teams that help organize them and share authorship. We need more sophisticated research and methodology. Um, Figuring out what our global burden of disease is, or even how many neurosurgeons we have on the planet, is surprisingly tough to get accurate data on. But the efforts so far are we're organizing research courses. We may even consider a new journal. And then, most importantly, young neurosurgeons. They're entering this global neurosurgical world. And we want to be sure that, in addition to the fine quality education they're getting in neurosurgical diseases, that they're being trained for working in any place that has a call for neurosurgery. We want to be sure that we are properly equipped and they are properly equipped, and to continue to build this responsibility, this culture of responsibility in our profession, so that we go beyond the duty to our individual patient and locality, but to consider and act upon our duty to all neurosurgery patients everywhere. So this is the new website. And the social media. We welcome the participation of everyone. We need everyone. We need your input and your support to make this goal of access to quality neurosurgical care for everyone a reality. Anything else, Tariq?
So I strongly recommend and request all of you to be there exactly at 1:45 p.m. today, so that we can launch the Peshwar recommendations, which is a comprehensive policy recommendations for head and spine injuries, care and LMICs. And it's a joint effort from the World Federation of Surgical Societies, the Harvard School of Medicine, and the Northwest School of Medicine. I think these are recommendations which are for the policymakers. And as I said earlier on, that we have piggybacked them on the National Surgical Obstetric Anesthetic Plan in Pakistan. And we hope that the rest of the world, the lower and middle income countries, also can do that. And I think these are recommendations which I think for us from lower and middle income countries, everybody must uh, uh, know what they are. We're going to, I think we've distributed copies of that recommendations. And also, if you don't have them, we are going to do that later on. Thank you very much, all. Thank you.
Thank you.
Thank you, Chair.